have a big community where I can just like have people come in a room and listen to me. So thank you. You're doing me a huge favor. That sheet, I just need everyone here to sign so my teacher or my professor knows that I had some people here. And just because the video is going to be uploaded on YouTube for me, my professor and my colleagues to see, so just need your approval for that. This speech is, last time I did a self-image speech. This time it's an informative speech on my profession or chosen profession. And I actually don't have a chosen profession yet that I'm sure of. So I picked a profession that I've always been interested in since I was a little girl. And that's, is it going there? Mm-hmm. Okay. And that's to be a clinical therapist. Now, this is probably not actually what I'm going to end up doing because, you know, money's actually important to me. So it's this is just, you know, as much as I enjoy it, I don't think it's going to really bring me the income that I'm looking for. But this has always been an interest of mine. It's clinical therapist. And what is clinical therapy? It's an independent job in which you assist, counsel individuals who come to you looking for help or tools to help them cope with certain life issues that they're dealing with. There's all sorts of people that come to therapy. You got to know how to deal with different people, like that happens in any other job also. Communication is a big thing with therapists. Also listening. Just a little fact is more than 1,500 mental health counselors are licensed for independent practice in the U.S. I got that from the American Mental Health Counselors. Clinical therapy it's definitely like a more independent practice, as a fact kind of states. I like that about it because I'm not the best person at following rules, so I see myself in a situation professionally where I am a leader, where I make a lot of the rules, or, you know, I kind of run things. Good thing I know that about myself, and I can, you know, apply that to my future. Skills and requirements. Education and psychology, obviously, you need to know a lot about people's brains, the way that they work. You know, there's a lot you can learn about people because everyone's so different. Language skills, definitely knowing how to communicate in the right way, being sensitive to people. Mathematical skills, you gotta be able to do basic math, as that applies to most any job. Because, you know, you do have to work with money sometimes, and you have to bill people. Reasoning, being able to reason with people. Some people are difficult, a lot of people are difficult. You can't just yell at people whenever, you have to be sensitive. And then certificates, licenses, registrations, physical demands, things that can basically prove that you have earned all the requirements to become a clinical therapist. That I also got from the Society for Human Resource Management. What does the clinical therapist do? Assessment, diagnosis. People come to clinical therapy to figure out, what maybe mentally is going on with them. Treatment options, treatment planning's up there. Psychotherapy, brief and solution-based therapy. What can we do to resolve this issue? If it can't be resolved, what can we do to help it? Medications, if they do a lot of dealing with that stuff. Alcoholism, substance abuse treatment is definitely a very common one. Psychoeducational and prevention programs, there's a lot of programs that therapists would recommend their clients to go to for treatment and prevention, and then crisis management. That's a big one, is you really got to know that you're going to be okay in crisis situations, otherwise you can't really be a clinical therapist, because that happens very often. Another fact here. So yeah, that's pretty much what I have to inform you on clinical therapy. that's something I definitely see myself doing, whether I'm going to do it or not. But that's, I've always thought about being it since I was a little girl. I like to help people, as I said in my previous speech, if you were here or not. But, hopefully you learned something in clinical therapy. So thanks for coming. Show the audience. Did you?
Yeah, a couple times, but
Okay.
I'll do one last swing. There we go.